Thank you everybody for joining us online and in person to the PKD Foundation Connect 20 Conference 2023. My name is Hanna, pediatric nephrologist at Mayo Clinic, and we'll be talking to you today about networking, finding mentors, and building your village for PKD. A pleasure to have Ms. Phipps, Amber Phipps. She's a mother and a kidney donor for her child with ARPKD. That will be the title of our discussion. I'm going to start with the activity disclaimer. I don't have anything to disclose, and this material will be available by the PKD Foundations for education purposes only. I don't have anything to disclose. So the learning objective of this talk is to list strategies for finding mentors, and list steps to build a community with other individuals caring for children living with PKD in the family, and describe how to locate resources. We will be incorporating real-life stories or testimonials from PKD caregiver, like Ms. Phipps, and discuss her experience about benefiting from networking and mentorship and any hurdle, any challenges. We hope to create an emotional connection and demonstrate a positive impact of building a village. Let me start first about the people here in the room. Who is a patient with either ADPKD or PKD or a donor? Okay, and so you're either a patient or a donor. And are you an ARPKD patient or ADPKD patient? So ADPKD patients. And are you a patient or donors for ADPKD? You're patients, okay. And who else is in the room? Any provider in the room? We have a provider in the room. Okay, all right. And we have people representing from the PKD Foundation as well. Great. So for people who knows about ADPKD, I'm going to tell you about ARPKD. And for people who doesn't know about ARPKD, I'm going to tell them, who knows about ARPKD, I'm going to tell them about ADPKD. So there's two types of polycystic kidney disease, the autosomal recessive and the autosomal dominant. And the autosomal dominant polycystic kidney disease affected about 12 million people in the world and about 0.6 million in the United States. It's the fourth leading cause of kidney failure in adult after diabetes, hypertension, and glomerular disease. It's usually get diagnosed on average between age 30 and 40 through imaging tests, genetic tests, after they're presenting with various symptoms of ADPKD. And very early onset in pediatric, prenatally or early during childhood has been reported, but it's rare as well. They usually have a severe presentation and they have an early onset kidney failure and need for dialysis or kidney transplantation, but this is very rare. In the pediatric population that we take care of at various centers in the United States, they can present with symptoms in their teenagers, back pain, hypertension, diagnosed during routine visit with a primary care provider. Their symptoms of ADPKD can be variable: abdominal, back pain, hypertension, UTI, and kidney stones. This is for adult, for anybody with ADPKD. It's a progressive due to new development of cyst. The same cyst get large relentlessly, and that can lead to kidney failure and complication. There's only one FDA therapy of ADPKD, which is tolvaptan, in addition to other medications for hypertension and lifestyle modifications. And as people with ADPKD is aware, the risk is getting into kidney failure. 50% can reach kidney failure by the age of 55. And other than that, you can have infection into the cyst or pain, severe pain that can affect quality of life. While ARPKD, it's rare compared to ADPKD. It's usually diagnosed during childhood, infancy, prenatally, but very rare cases can present into adulthood. So ARPKD, there's few cases in the literature, like a handful of cases, they presented in their mid-30s, mid-40s with symptoms, and they found to have ARPKD. They have presentation early childhood with large kidneys, hypertension, fibrosis, or issues with lung development because they have issues with kidney failure or kidney problem during prenatally, so they don't make enough urine, and you need urine for the lung to develop very well. It's a progressive disease. It's not only affecting the kidney. Some people can have a prominent liver disease, fibrosis or bleeding, or liver cirrhosis or failure as well. So it's a very variable disease. It's progressive, but very variable and heterogeneous. I can have 10 kids with this condition. Everybody has different phenotype. One with severe kidney disease, one have a dialysis or kidney transplant, other kid with normal kidney function, severe liver disease, and a third kid with a mild presentation of both, and a fourth kid with severe presentation of both. So that can make it challenging for building a network and finding a mentor because it's not as a homogeneous disease as an ADPKD. An ADPKD, an adult, you know that majority of them will have the same path of when they present, what the complication, but in ARPKD, the presentation is very heterogeneous. We're trying to make it interaction. People online can ask questions in Slidos. The audience I may ask you questions about your experience on finding a mentors. We'll have the experience of Ms. Phipps as well, who's a mother of ARPKD patient and a donor of her child. And just to try to have a good discussion about what complications or what difficulties, in finding a mentor or connecting with other people in the community, and how can we improve as we are presenting this in the PKD Foundation Connect conference. So what is a mentor? Just a general definition specified for a mentor. So a mentor is an experienced and knowledgeable individual who can provide guidance, support, and advice to someone with less experience in a particular field of area of interest. So you can have a mentor for basketball, a mentor for math, you can have a mentor for biking, any type of subject or any profession. So the importance of having a mentorship is to manage PKD and improving the quality of life for the patients and family members who are seeking mentorship. The mentor provide emotional support. They provide a source of encouragement, understanding, and empathy to the mentees. The mentor can be a mentee at early stage of the disease, and then they can be a mentor. A mentor can be a mentor right away without being a mentee, especially that if the mentee is not a patient with PKD or is not a family member. They can provide guidance to the mentees. They can offer practical advice on symptoms management, treatment option, and lifestyle adjustments. Personal guidelines, or personal opinion, or even if the mentor was a physician, they can provide a clinically approved recommendations or studies that have been shown to improve the symptoms of PKD patients. They can share experience. If the mentor is a patient with PKD or a patient who donated the kidney to a family member of PKD, they have personal experience they can share with the mentees. They empower the patient to take an active role in healthcare decisions as well. As you know, that the mentor and the mentee's relationship are not 24/7, so it's not like a relationship between a kids and the family member. They're not available 24/7. So But one of the roles of the mentor is to provide the mentees an empowerment to take an active role in healthcare decisions as well. Improved coping. Mentor help patient navigate the emotional impact of PKD and develop effective coping mechanisms. And overall well-being. Mentorship fosters a sense of belonging, reduces isolation, and enhances overall well-being. Before I start with my next slide, the tape of mentors, I'm gonna ask Ms. Phipps, and I'm sorry, I should have done this earlier, just to introduce herself and her roles and what's her roles in the PKD Foundation. Is this new things to you, or you've been part of the PKD Foundation?
Yeah. So I am a parent of two. I have a daughter who is 12 and she is healthy, and then my son who is 9 has ARPKD. He was diagnosed in utero just a couple days before we did like an emergency C-section. My husband and I were unaware that we were carriers, hadn't even heard of PKD until that day, so it was a very new kind of thrown into the fire world for us. And it's kind of felt like that ever since, honestly. When he was 4 in 2018, he was able to have a transplant, and I had the honor of being the donor, like he mentioned, which was an amazing experience, but also, again, terrifying and scary and wonderful all at the same time. This is my first PKD conference. I am new to this world, and really, honestly, the reason for that is because our primary focus has just been on Griffin, just getting him through that, and it wasn't, so our kind of experience with mentorship and kind of networking happened organically throughout that time, and it wasn't until after transplant that we really started to feel the calm and tried to reach out ourselves. So it's kind of a new world for me, but it's been pretty exciting. Yeah.
All right, thank you. And I will add to it because your son had a severe, from a kidney perspective, had a severe kidney presentations, and as a family member, the first focus should be on your child. I mean, other family member who have ARPKD kids, but they have a mild disease, they may be able to reach out to be an active participants. So yeah, I think that the message here is take care of your family member.
Absolutely.
And make sure,
I'm sure that you guys know sometimes you're in the middle of it and it's like you've got one focus. And networking at the time isn't something that you're intentionally looking for. It usually happens organically. You find these connections and support in people because you needed it at that moment. But the focus is definitely just getting through that.
Yeah. So the type of mentors, just question to patient with an ATPKD in the audience, and maybe we can, if anybody wants to answer, is like, do you know if I tell you type of mentors that you can seek up with, and any of your experience? You can introduce yourself.
I mean, I guess there was, so I guess when I was first diagnosed a few years ago, I was kind of paired with a mentor through the foundation, but we had just, I think, like one conversation, like a couple of emails, and it never really kind of like went beyond that. But I also think it was maybe because like I didn't really follow up and that kind of thing. So I guess it's something that I kind of explored a little bit, but then it kind of hadn't really focused on. But now I'm kind of interested in it again a little bit as I'm kind of beginning to like find out. I mean, I've been diagnosed a few years ago, but like find out more about my diagnosis and getting kind of like more involved in different ways to network and learn about PKD, because it was sort of something that I hadn't really focused on much, just because there's been other stuff that's been more kind of pressing.
Yeah.
But
Okay.
I guess I don't know if that answered your question, but
No, yes, I just wanted
Okay.
to have an open discussion and just,
Okay.
any challenges, any opinion are welcomed. So yeah. So when you look for a type of mentor, there can be many types, from a family member to a patient, to a person you don't know. Other PKD patients and their caregivers, individuals who have further experience with the condition and can provide valuable insights. So either a child who went through the disease of ARPKD or ADPKD and now an adult, and he can be a mentor, and he can be a mentee as well. And a caregiver, either a family, a mother or father of a patient, if there's any directed benefits other than taking care of the patients. What I mean by direct benefit, by offering kidney donation or as directly or as a part of the payer exchange program. Medical professionals, nephrologists, urologists, and other healthcare providers with experience of PKD. They can be a mentors, but also there is limitation about having a mentor-mentee relationship is not something can supported by the medical institution of the physician. So sometimes there's a limited time for work, and this has to be done outside of the work, after hours, during the weekend. So there are a nephrologist that I know that they can work as a mentors or mentees, as a mentors, not a provider who provide treatment or to manage blood pressure, but just to provide support of the patients. And finally, support group and organization like the PKD Foundations that can connect patient with mentors. Amber, with this type of mentors, when you try to reach out, how did you try to identify mentors, and any of these in the list were type of mentor that you get the benefits from?
Yeah, so at the beginning, I had it in my mind that I had to find another mother who had a child with severe ARPKD that presented in utero that needed a transplant right away. And I didn't find that. I definitely didn't find it in my community. It was hard to even find online because of how rare my son presented. And in my mind, a mentor was somebody who had been through the exact same path as me. And so I kind of closed myself off pretty quickly. And so one thing that I had to realize and grow into was that a mentor can be somebody that can support you in a piece of your pie and provide a ton of valuable support in an area, even if they don't know all the ins and outs. Because everybody's story is slightly different. I'm sure that it's the same way in the ADPKD world. Your experience could be completely different than the person sitting next to you. So when I opened my mind and kind of started to think about it differently, then I kind of had this world of support. Some of it was already there in respite providers that came and cared for my son. They had never cared for an ARPKD patient at the time, but they had been in hospitals, and they knew what it was like to be with those parents. They knew what it was like to have the ins and outs of the blood pressure and the medications. And so they were already speaking into my life. And then also I realized that by reaching out to other families in my community that maybe had chronic illnesses, mothers who had been through that, mothers of kids in my city who had cancer, they ended up being some of my stronger mentors because they could understand the emotional aspect and provide support, even if they didn't understand when I mentioned a medication, what it exactly meant. When it came to the medical community, I definitely found some parts of mentorship, even in my doctor's appointments. Like you said, there's a limited amount of time, but every once in a while we would find a doctor that you could just tell wanted to take that moment to go that extra mile. And maybe I had a GI doctor once break out a textbook and really kind of walk me through. And I walked away from that appointment feeling so guided, and he stuck with me. And so every time we had an appointment, it was amazing because he was an amazing Mayo Clinic doctor, of course, and he provided excellent care, but also that he went above and beyond and helped us feel supported from a medical educational standpoint as well.
Thank you, thank you. So yeah, just to add to the type of mentorship, especially in the medical professional or actually patient or caregiver, you don't need to be part of the PKD or a family member with PKD. You can, if your child is on dialysis, you can reach out to a family who have kids with dialysis, because after all, the dialysis machine or the way they do dialysis is the same for regardless of your type of end-stage kidney disease, and also a kidney transplantation. There's no specific difference between a kidney transplantation technique and the medication that you take between ARPKD, PKD patient, non-PKD patients. Thank you. So different approaches to finding mentors. And Amber, I need your help at the end of the slide to see how, if any of these ring a bell or you try to approach and do you have any challenges in them. Number one, seeking recommendation from healthcare providers. So you can ask your healthcare provider if he can be a mentor or if he knows about any other healthcare provider with a having a maybe a degree and other than MD, like can provide a good mentorship, like a social worker or a philosophy or a PhD in mentorship and communications. Networking events or conference related to PKD or pediatric healthcare in general. We have, I think, the only conference that's related to PKD that include the pediatric PKD population is the PKD Foundation. We have some pediatric healthcare conferences. The issue with them is there's a lack of interest in our community, pediatric nephrology in PKD. I can name less than 10 people in the United States. Yes, I think because it's rare, heterogeneous. To have a village. So I think there's some limitation from our part. And the poster and presentation about this condition in pediatric are scarce in our international or national meeting. I'm talking about the United States. I think in Europe probably they're a little bit ahead of us in terms of recruitment and having a network and conferences. Online communities and forums dedicated to PKD caregivers. I'm not going to name any specific, but I think just to some attention, some of them may not be provided through information, and they can to have as a patient or caregiver want to look for mentorship. Just I think seek help and guidance from other people that you know regarding these communities and forums. And local support group or organization focused on PKD as well, either in the same city and the community. Or in the hospital system or the insurance care system that you're part of it. So Amber, when you try to look for mentorship, how did you, what approaches did you use and did you find any challenges?
Yes, we had a lot of challenges. We did reach out to our healthcare providers, especially around transplant. After transplant, I asked if there were any other mothers that had transplanted to their sons with ARPKD that I connect to. And they said, hey, we would look, and they didn't find any. And so we struggled with that. We couldn't find just a slew of names or even a conference to go to that would be specific to that, kind of like what I touched on earlier. So there wasn't a lot. We reached out mostly through online communities because we could access the European group. There were mothers from Europe that were on there that they had a lot more resources, and they were also a lot more familiar with networking because I think that they have a broader approach over there in it. And so I connected with people overseas, connected people in other states, obviously. And so that's kind of where our pathway was the online forums, the ARPKD CHF Alliance. That's a big page for us that we were able to connect on. There was a lot of support in the hospitals from palliative care. At the hospitals there, they provided a lot of support in the terms of being a parent in the hospital. So when we were in a hospital setting, we found there was a lot of community there. But it was when we went home that we didn't have that. And it was a balance of trying to still want that, because especially when you're going through it day in, day out, you want to be normal. You want to go home and live a boring life. You love the appointments where they're like, well, I don't got anything to say. And you're like, okay, bye, I'm good, let's go home, So sometimes when we would go home and away from that desire and need would kind of wane for a while. And so the online communities is what really held that up, because it's real easy to log on, to have a chat with somebody, and then every once in a while I would find a mother who was kind of close by, and I would reach out and be like, hey, you want to have coffee? In fact, the only mother that's within driving distance, I just discovered a week before this conference. And so I immediately reached out to her and was like, you have a kid with ARPKD, let's meet up, let's have coffee. So, but it was through those online platforms really for us.
Thank you. Any comment from the audience, you're welcome to raise hand and speak out. So just making it, I know I would like to do it as a round table, but because of the online audience, we were not able to do it. So anytime you want to talk, please let us know. So, so once you identify your mentorship, you want to maintain a strong mentorship relationship. It requires an effort, active participation from both the mentee and the mentor. And here are some of the key practice to consider when you identify a mentor, regardless of the mean that you used. I think you need to set a clear expectation and goals from both sides. Like, I'm a mentor, you're a mentee. We need to set in clear expectation, including maybe talk about regular communicating and scheduled meetings. Should we meet once every 2 weeks, once a month, or we have some semi-urgent meeting if there's anything come up in the side of the patient or the caregiver. I think not every mentor and mentee relationship can last. There's maybe some hurdle that feel comfortable. So being open and receptive to advice and guidance, and for the mentor also be receptive to feedbacks, and because it's after all it's a relationship that targeted to maintain good relationship and improving the care of the caregiver and the patients, and also express gratitude and acknowledgement of the mentor's support. To be a mentor is a tough thing to do, and if the mentee is feeling very comfortable with the mentors, I think in expressing gratitude is an important thing as well. I just wanted to share some mentoring story from the PKD Foundation that I took it from the website. And I'm sorry if this font is very small for me to read, but I'm going to try to do myself. This is a patient. Her name is Michelle Carl. She's a mom of 3 boys, her 3 Ps. She is not a patient with PKD, but 2 of her children had ARPKD in 2006. And unlike Amber here, her both kids had a mild disease. You can understand the difference in the heterogeneity of this and the presentations. And she's been in a special education preschool teachers, and she has she is always available to talk with parents with children with PKD. I would say very good initiative from Michelle. I would mention, I'm not sure if her kids have severe form of ARPKD, she will have the time and the effort to be a mentor for different people. And how is her interaction with other family with ARPKD, with children with severe presentation as well. So that can be she may not have the personal experience to discuss with other family with severe ARPKD, but she is willing to provide as much as guidance. And I see there's a lot of, in the community with ARPKD, of the same presentation as her children's. So she would be fit as a good mentor as well. Another patient, Wayne Smith, he had and this is in the PKD website, his dad has PKD. He was diagnosed with PKD when he turned 40. And he was on dialysis, and then he got the honor to get a kidney transplantations in 2019, and then he was able to meet his donor, and he's I think actively active member in Seattle chapter and wider group with as a peer mentor as well. So you can see the mentor could be a mother of a patient or could be a patient himself with an experience among family member. If there's anybody here can share any experience with being a mentor or a mentee as a patient, if there's no? Good. Okay. So what are steps to build a community with individual caring for children with PKD? It takes time, patience, and effort, so it doesn't happen overnight. Step one, you need to identify a potential community members. Reach out to other parents, caregivers, family members, as Amber mentioned, who also caring for children with PKD. That's the first thing you need to do, reach out to other parents. That could be through the networking outside of the clinic that the patient is being taken care of, or that could be through the providers who probably taking care of in a big center, probably taking care of other patients with PKD. So as a physicians, if a mom with a patient with PKD want to connect with others, I have to ask permission from other family member, and they usually open to provide guidance. And then we can have exchange emails or numbers, and then they can take it from there. And connect with PKD organizations, support group or online community, especially tailored to family or caregivers. And I know that the PKD Foundation is doing a lot of things in this regard, and they have focused into providing fund for PKD research in children's, and that can be part of the fund if a person have an idea to improve the mentorship among this community as well. So that's an idea for a physician or caregiver to consider. The initiate communication and sharing when you identify a mentor, start conversation with other caregiver, both online and offline, to foster connections. As I mentioned, I mean, they can take it from there without having the primary care provider or the nephrologist involved in these. Share experience, challenges, be open related to care of children with PKD, and utilize social media platform, forums, and or other local support group meeting to initiate interaction. Again, this some of the information repetitive, but they're part of the to help how to maintain the good relationship. Amber, anything to say in this regard? Establish regular meeting and gatherings, the third steps to maintain good mentor relationship. Advocate for setting up regular meeting or gathering, whether in person, virtually, or provide dedicated space for sharing and support. Discuss topic that's a treatment option, coping strategies, education resources, and emotional well-being. And suggest rotating the responsibility of organizing meeting among community members. If there's a community members, a family members, it doesn't need to be the same person, the same family who are active. I think they have other things to do, caring of other children, their own, I mean, they have job to do. I think rotating responsibility is very important to have a successful mentorship program. How to locate resources. I mean, to be frank with you, I haven't seen any resources other than the PKD Foundations. And the PKD Foundation have in their website, they have a pkdcure.org/peer mentors. They have a peer mentors, and they have few options, a training series. They do a peer mentoring quality training calls, and they have some video series, and they have resources for immediate help. In addition to that, the PKD Foundation can provide education materials for ARPD and ADPKD and related to the mentorship mentees. They can provide access to expert advice and medical information. And as I mentioned, they have funding opportunity for research and treatment advancement. I think this year they're supporting between 8 to 10 research studies. And I think one of the two category of them out of 4 main category is ARPKD, regardless is pediatric or adult, and children with PKD. So, so thanks to the PKD Foundations. So this is my contact information. I think we are almost, we're good. We have 5 minutes. So I think I'm done with my presentations. Amber, if there's anything else from your end to add? Any closing comments?
I guess I would just say, for me, speaking about my experience to other people openly in just a raw way, being honest and saying how hard it was or how much I don't like certain things. That has brought me closer to people and developed more of a relationship, because that's really what we're looking for, right? We're not looking to just be able to stand up and say a lot of nice, really pretty things to people or sit down and go home and feel like, man, I was a great mentor today. We're looking to make connection, to build better lives, to have a better understanding of what it's like to live with this disease, and to answer that question, like, am I alone in this? You know, we're always looking, that's the goal. So when you have interactions with other people, I would say my only advice is to be really real with them and to be honest when you're talking about how it's affected you, because that's usually what everybody else is looking for. When they hear that somebody else is willing to say it, then they open up, and then you have real communication and conversations about what it's like to go through the disease. So be brave.
Any questions from the?
Now, no.
Okay.
So we do have time for questions. I don't know if anyone has any thoughts
Any
that they would like to
questions, comments
share.
from you? Just give you the mic. Yep. Thank you. Thank you, Amber.
Hi, my name is Chris. And when looking to find a mentor, can they match you with like a mentor if you identify like certain characteristics of kind of like what you're looking for in a mentor, or about like, my own condition? Can they match you with someone that basically kind of like fits that criteria, or is or does it depend just based on kind of like who's like available too?
Because I'm not of the PKD Foundation mentorship committee, so I don't know the answer, but that's a great idea. And especially with adult ADPKD, you may have pain is your main problem. Mm-hmm. You may have mild kidney disease, or you may have a brain aneurysm, and somebody with ADPKD had brain aneurysm and led to complications, sequelae of weakness and other things, and they wanted to find somebody with this characterization. So I think that's a good idea to connect with other people with the same. In regard to the ARPKD patients, it's rarer than the adult ADPKD or autosomal dominance. Also, you may not find a complete match of your child, because it's a very heterogeneous condition. So I'm not sure if this is resource available and there's a matching in the PKD Foundation. So I will, I don't know if you know the answer to that, if you can comment to it.
So I can provide just some insight. So we would have a conversation with you if you expressed that you wanted a mentor. We'd have a conversation about what are you trying to get out of it, and match you with someone from there. So it would definitely be a conversation, and then try to fit you with the best person.
And to be frank, when I was asked to present this for the meeting, I was not aware of these resources. So now if the family are struggling and wanted to talk, I mean, I see kids with ARPKD, ADPKD, especially with ADPKD, they don't have symptoms, they don't want to hear about it. They're here with their families. I tell them, we'll see you back in a year. They may not seem interested, but now if there's any in the community, like a children with their condition, they may connect with them in a safe way. Under family supervision, that would be good. Also with ARPKD patient, I don't see a lot of ARPKD patients. Maybe we see one new diagnosis every 1 year. So to have these resources for them is also a good things to do. And I just got to know Ms. Phipps. Her son is a patient of a colleague of mine, and if she's willing to be a mentor for patients with ARPKD, I can have them reach out to you. I just want to mention things about, you start as a mentee, as a patient or caregiver. You can be a mentor, but you can come back to be a mentee if you need help. And so this transition from a mentee to a mentor is not one line. You can be a mentee, mentor at the same time.